shoot them off whenever you think of them. Don't feel like you got to wait to the end. There's a couple people I actually don't recognize. So I'm Eric. If you don't know who I am, we launch that thing. Yeah, go for it. This is also broadcasting live via Facebook, so if you guys have any privacy issues, don't walk in front of the camera with that through there. Obviously, thank you guys so much for coming on Saturday. I know it's kind of tough to carve out some time, but I would start that how many people think breathing is important, right? So we are going to be talking about breathing, and specifically how breathing relates to neck pain today. And it's something that I found within my practice that really has helped get people mobile, and it gives them something to do even when they're not super like mobile. They might be really flared up, but it's still an entryway to start getting things better. So my goal today is to kind of go through some slides, kind of talk about the what we're going to see, some trigger points, things like that. And then really the meat and potatoes of it are the techniques that I want to get into, and that will kind of spread out on some tables. We'll kind of go through some different techniques. I will be getting you guys a printout. Did you break it?
I didn't break it.
Okay.
I hit live and then it closed.
Okay, just reopen its Facebook pages.
Okay, do you just hit live?
Yeah, you hit live and you can paste it or whatever. Okay. So, but yeah, the meat and potatoes is going to be the techniques of all this sort of stuff. And so that's really where I want you guys to get a lot of value out of it. And if you guys have questions in that's going to be kind of a free for all in that sort of game. And then I will show you kind of some of the things that I do as a therapist as well. So where you can manage yourself, maybe where physical therapy can help you in the long term as well. So obviously this is the breathing connection, and I've probably got to get on the right page so I can actually cycle through. See if that works. There we go. I think I already talked about all this sort of stuff. So one of the things that identify where tension and stress headaches come from, where the referral patterns are for different types of headaches, because that's going to clue us into maybe what's being overused or underused as well. And then, like I said, learn different breathing techniques. And if you've been here before, you've probably been subjected to some of them, but some of them I hopefully are new as well. So how many people have had stress headaches or tension headaches before? How many have one right now? Not yet. So you can relate. It feels like your head's in a vice, and it may be single-sided or it might be both sides. A lot of times they sit in the forehead or behind the eyes, and it's often, chronic posturing or protective guarding. Maybe that's pain, maybe that's stress, but something has provoked that to where we're tensing up the wrong things and causing pain. Different muscles cause different referral patterns. And so we'll talk about that down the line as far as where you might feel it versus the temple versus your jaw versus kind of behind your ear and different things like that. But it's pretty frustrating because certain things might trigger it, sometimes might not. And a lot of times there's that X factor as far as stress and emotion that can trigger these as well. So we've got maybe some physical stuff, but we also got some emotional stuff we need to start addressing as well.
Eric, is there any way of knowing what type of headache you have? Are there any real clues that, well, this is just a tension or there's something wrong?
So you're asking is there a way to kind of decide headache versus something more wrong with that? Right. Typically, if we have something wrong, like let's say we're stroking, we're going to have other physical manifestations of that. Migraines typically are preceded more with like an aura, and they tend to be triggered by consistent things. Foods, loud noises, lights, things like that. And that's something that the pattern will establish over time. The first time you have a migraine, you might be in the ER because you're not sure what's going on. Certain things will help take those migraines away. Caffeine, other possibly drugs and things like that will help, which won't help a tension headache in that regard. Did I answer your question?
Yeah.
Okay. Yeah. We'll get to more too. So if I don't, let me know. And so tension headaches are one of the most common headaches we see. And they occur in pretty much everybody. How many people have had a headache this week? Right. So hopefully they don't last too long, but they can, particularly if we're stuck in kind of a guarded posture. So it's very, very common. I hope that by the end of today, we'll have some tools that can give you some techniques to at least get out of it on your own. So why is that, right? That's the big question. And it really comes down to the stress response. And I like to kind of precede this as far as stressors, like stress is good and it is bad. Exercise is a stressor. We stress our muscles and we get stronger. When we have too much stress is when it becomes a problem. And whether that's emotional stress, auditory stress, loud music can pump us up. Too loud of music can drive us nuts. So it's how your body responds to the stress that we're going to see that. And we'll talk a little bit more about kind of the buckets of stress and what happens when we have a stress response. But it leads to what we call an upper cross pattern. And basically, this is a combination of kind of protective instincts and reflexive type guarding. And this is something that was pre-built in you when you were born. You don't necessarily have a choice with it. And then it alters your breathing, obviously. And that's why we're here talking about this, because breathing is one of the easiest ways to change this protective response. And then it facilitates muscles to fire. That can cause pain. A lot of times then those muscles are tight. They have trigger points that causes more pain. And then we end up in this vicious cycle where it feels like I can't get out. Everything I do makes it worse. And so hopefully by the end of today, you'll have some tools in your toolbox. Upper cross posture is kind of the classification system for what we call this protective guard. It looks like you're working on a computer, right? And half the time that's part of the problem, is that we stuck in this posture just through what we do day to day now. We used to plow fields and hunt jaguars, and now we're typing emails all day. And so we facilitate this posture, which is then reflexive in nature relative to stress, and it becomes a big problem. What tends to happen, the head comes forward, the shoulders round. And what happens is that these get very, very tight. These get weak. These get very, very tight. And these get weak as well. And so when we have that kind of pattern, then we start to sit in it, it becomes a significant problem. And that's where we see these recurrent headaches where people say, I've had a headache for years and I can't get out of it. And part of it is posture, part of it is stress response. And so we have two nervous system responses for how to deal with stress. We have the sympathetic system and then the parasympathetic system. And sympathetic system is our fight or flight. This is when we're starting to get attacked. Heart rate jacks up, our eyes dilate, and we run as fast as we can. Like we get really, really strong. That's why people can lift cars in accidents and things like that. That is all responsible for the sympathetic system. Parasympathetic is the rest and response system. So that is your, when I think parasympathetic, I think parachute. It slows everything down, increases digestion to rest and relax. And we tend to be as a society more into the sympathetic side versus the parasympathetic side. We want more parasympathetic on the whole for most people. There's a rare occasion where we might want to jack some people up, but that's not usual, okay? We are still stuck as a human species in survival mode. We've evolved, like our brains, and we've got all sorts of nice little tricks that we can now drive, but ultimately we are still pretty much the same as we were a couple thousand years ago. So stress affects us the same way, even though we have different ways to manage that now. We might be able to sit versus walk, but stress will still affect us the same way. And so when we have too much sympathetic stress, we end up in this protective guarding. You're a baby. What happens when babies get stressed, right? They curl up in a ball and they get really, really angry and they scream really loud and then they're fine. And that's exactly what we're going to try to practice today, is trying to get all our air out, because that's one way we can actually guard ourselves. But our body can't filter out good stress versus bad stress. It just perceives it as stress. And we have a bucket of stress, if you want to think about it. Once we hit a certain level of stress, we go into a stress response. Good, bad, or indifferent stress. Maybe you had a bad day at work, like I'm going to go to the gym and work it out, and you listen to some really loud music, and then maybe you didn't get a good night's sleep, and now you have a headache. Okay? Maybe that was very normal for you day to day, but maybe on a Tuesday, that triggered it. So that stress response becomes very, very important. Our goal with some of these breathing exercises that we're going to teach is to empty that bucket out a little bit, give you a little more variability so that you can allow more stress into the system without flaring it up. We can't necessarily change the stress that comes into our life, but we can change how our body adapts to it. Well, I guess we can't choose some stressors, but that's a different conversation. The protective guarding that kicks in is basically the fetal position. So when we're looking at these postures, how many people have tight shoulders? Right? How many people feel tension here? Okay. How many people think their hips are tight? Right? Okay. When we are in a stress response, we come into the fetal position. And that's not that we're always sitting in that position, but we are guarding in that position. The muscles that pull us into those positions are the ones that are going to get tight. Good morning. There should be some food back there. Good morning. Glad to see you. So those are the muscles that guard us into that response. And you're not going to be sitting here curled up in a ball. Well, you might be, but you're not going to typically be that. But those are the muscles you're going to be like, man, I don't know why this is tight. Because it is a protective response. It's built into you from day one. Okay? So our goal is to kind of reverse that. So trigger points. How many people feel like they're really tight here again? Decent amount. How many people have had a headache here? Okay. What we call a ram's horn referral comes right up into there. So if we're in that protective response and this guy's responsible for it, we might get headaches in the temples, both sides or one side, kind of depends. How many people have had tension, well, maybe a little bit lower? How many people have had pain where all that red is? Okay. again, now we've got to make sure, and that's a physical therapist job or somebody elderly professional to make sure it's not a shoulder or neck issue. But very, very commonly, I'd say maybe 80% of the people I see, trigger point and levator is one of the biggest things I see. Okay. And often when you're grabbing your neck, you're grabbing levator, you're not grabbing the upper trap as much. It shouldn't even be there. It's a structure that we had when we were crawling on our hands, and that's a different argument for me. How many people have had tension back here or tension above the eyeball? Yeah. Okay. These guys here. Okay. When we're stuck here, the only way we get to move our head is using these guys here. Okay. We should use the muscles deep to the spine, right next to the spine to stabilize our neck. But when those don't work, we use something else, and a lot of times it's these guys here. So taking into some of the stability postures and things that we'll talk about, that should help reduce that. How many people have had coming across here, maybe sitting behind the eyeballs? Yeah, feels like maybe, and this can often be confused with a sinus headache too. You know, people will be like, oh, maybe it's just sinuses, but then nothing changes when they do all their sinus stuff. It's usually the suboccipitals, and those are the little muscles that sit kind of behind your skull right here. There's 4 of them in a very small area, and they serve as the gyroscope for your skull. And so basically, they're telling you where your head is at in space. So if these are really, really tight, not only can they refer pain, but they can also cause dizziness or vertigo as well. And I see a lot of people who end up getting kind of dizziness and that sort of symptoms relative to these. How many people feel like they clench their teeth when they're stressed?
Yeah.
Right? The masseter, one of the big jaw muscles that helps you chew, can refer pain and a headache into it and above the eye. So very commonly with folks who have headaches, we actually do some intraoral stimulation and get some of those released, and they get really good relief with it. And then temporalis, another chewing muscle. How many people have had pain into that side right here? Right? Yeah. That could also be from clenching. Temporalis is another chewing muscle through there. When you're sleeping and things like that, if we have a stress response, a lot of times the natural, we revert kind of back to that baby oral fixation side. We do things with our mouth that we're not even aware of. And we tend to clench, or we might be tensing our tongue, pushing our tongue against the back of our teeth. So nerves, greater occipital nerve is one that we really want to talk about. It sits between all those suboccipitals. These guys here, you got 1, 2, 3, and then the 4th one is kind of resected back there. The nerve comes out from the middle of all those. And so if you can imagine, if that gets tight, it gets compressed. That nerve runs from the back all the way up behind the eyeball here. So if that gets really, really compressed, you can get pain. That's why they often will recommend doing a nerve block. So that will stop the pain, but it doesn't necessarily change the compression on that. And so that's something that you really want to make sure you evaluate. Can you release the pressure? Does it relieve the pain if you're up on the dock for something like that? So with physical therapy, a lot of you folks have been in physical therapy, and that's awesome. So within physical therapy, now I want to teach some of the breathing stuff here, but within physical therapy, there's lots of things that we do. And if you're not familiar with it, one of the big ones is posture, educating you on that, but also teaching you the corrective strategies to get out of that fetal position, teaching you the right things to strengthen, the right things to loosen up. A lot of those you can do on your own. Some of the things you can't, we use a metal tool. Grafton. How many people have had Grafton here? Yeah, I hope most of everyone who's been here has. And when we have kind of chronic tension, we get muscle fiber that doesn't want to move. This metal tool is going to help kind of get things moving a little bit better. We have dry needling. That's a great trigger point management. All those big red pictures that we've seen before, that's a great tool to do. I know Terry's dry needled before. Anyone else have dry needling? Yeah, you've seen me, you've probably been dry needled. But that's a great trigger point technique. That's not necessarily going to guarantee that we loosen the muscle or get the muscle longer, but if we have an active trigger point that's causing pain, that's a very, very good bullet to shoot. And then joint mobilization manipulation. Anytime we have chronic tension, the joints get stiff. If you don't ask something to move, it won't. And so oftentimes we need to tackle the joints, whether that's a snap, crackle, pop, or whether that's just a gentle mobilization, and depending on your tolerance and how aggravated your symptoms are. And then we want to reset the norm with exercises, and that's why we give every single one of you a home program too, because we need to start figuring out how you can manage this at home, not only from a stress reduction and stress management, but also an activity and posture type standpoint. What questions do you guys have right now? I know that was kind of fast and furious, but like I said, my priority is to kind of get into the meat and potatoes as far as the techniques, so fire away.
Do you mind just kind of quickly going through the list of trigger points one more time?
Absolutely.
Kind of
And I will be emailing this PowerPoint out too, but yeah, absolutely. So go back through here. So upper trap, top of the neck through here, refers kind of what we call ram's horn referral, side of the head, up the jaw. Okay. levator scapulae. Sits just deep to that upper trap, and it's got a pretty broad referral pattern through here. When you're reaching back, you feel that rope through there. It's not up here, it's way back here. And a lot of people start grabbing levator. If you have any sort of shoulder or scapular instability, levator is always going to kick on. It's always going to be a little bit tight. Whether it gets a trigger point depends on your irritability. Okay. SCM stands for sternocleidomastoid. That's why I abbreviated it. But it sits here. It's this guy. If you turn your head and then lean your ear towards your chest, that big guy that pops out here. It's one of the main folks that turn and rotate your neck, and it should be one that drives a lot of movement. Problem is that when the deep neck flexors kind of fail because we're stuck here, these guys start to stabilize. So you have something that's supposed to move you now holding as tight as we can, and then you get us to move it, we get a conflict of interest. Suboccipitals, and honestly, I feel like this picture is kind of a liar. Suboccipitals sit back here, but they usually refer, they can come here, but most of people will say it's behind my eyeball or right behind my eyebrow. And it's right across through here. You get that kind of band across your forehead. Masseter, if you clench your teeth, like that pops out right there, that's your masseter. And most people, if you poke on it, it's kind of tender. You know, it doesn't get poked often, but it is one of the strongest muscles we have in our body. And it can really, really tighten up and get dense trigger points in there and cause a lot of referrals, a lot of TMJ type referrals too, or ear pain is what you hear a lot. It feels like it hurts on the inside of my ear. And then temporalis, we tighten your teeth and you can feel these guys up through here, more sitting up just above your ear a little bit. It's a long, thin, kind of fan-like muscle. It sits like a big hand on the side of your head. And the trigger points sit right above, you feel your cheek arch, right above that. That's where it kind of starts. And then trigger points in there can work for the top level of teeth, but also kind of this broad, diffuse kind of side of your head pain. Occipital nerve. And there's lots more we could talk about. Those are just kind of some of my favorites and some of the classic ones. So if you have more questions, catch me after and we can definitely go deeper down that rabbit hole for sure. What other questions do we have before we jump into all the fun? Awesome. How many people can blow up a balloon? Awesome. We'll see. Yeah. Okay. So we've got several tables through here. Everything should be clean. So let's hop on those. We're going to move into the treatment side of the world right now. And then we're going to pass out some balloons. I'm going to give you 3 things to work on. I will get you a printout. I was going to print it out before, but the thing is, it sounds like a jet engine taking off. So we'll hold off on that for a second. And then we'll go up. Questions, feel free. We'll kind of just try to do a round robin, and I'll show kind of techniques on one person, and we can kind of go around and have everybody experiencing that. Okay. So again, if you have questions, let's fire away. Yeah, let's just kind of diffuse through there, and then we might move this back through here. Yes. Well, let's just move that and follow me around.
Well, he's not have to do it, so.
Oh, we got shared to the Chandler PT thing. That's fine. Not a big deal, one way or the other. I'm gonna move this really quick. Stop screen sharing. Awesome. Guess you probably don't want all the laundry, do you, Terry?
No, I was getting out of the way, really.
Yeah, the story of my life, Terry.
I know where it goes. You want me to go put it
No,
up?
that's not your job.
I know where.
Too long and too many times.
Perfect. And if we could get everybody laying on your back, that would be awesome. Okay. And Carlos, if you want, we've got pads back there. If you want to grab one of those, totally legal. Put that there. And I lied to you because if we could, can we pivot so our head is on the inside of the room? Because it's going to make it a lot easier to work on. So the three kind of techniques that I'm going to be talking about, we're going to talk about balloon breathing, one of my favorites. And we'll talk about it relative to that kind of protective guarding we're talking about. We're going to talk about just diaphragmatic breathing. Easiest way to tap into that parasympathetic nervous system that we were talking about earlier. And then we're going to talk about what I call box breathing or long pause breathing. And we'll kind of get variations on that as well. So everybody got a comfortable spot with that? Trey, you got that rolled out if you need to. Okay. Put your ass over here. Somebody can have this table. What color do you want there? That one. Red, right? Yeah. There we go. Choose wisely, Billy.
I know.
Yeah. Nope, I'm sorry. If anybody needs an extra balloon too, you let me know. Well, I will show you here shortly. I just figured we all know that. I'm really glad. I'm really glad. No.
I'm having my first. If you want me to-
You, of course, you can play. Everybody can play. So with balloon breathing, when we get stuck in that upper cross posture, that protected fetal position, not only do you always get tight, but we shift from what we call a belly breathing pattern to an apical breathing pattern. That's an upper chest breathing pattern. Several muscles that contribute to those sorts of things. A lot of times it's these guys through here, and what we call your scalings. They attach from your neck, run down the top couple of ribs. And if those are tight, we think 20 to 30,000 breaths a day, depending on how fast you breathe, we get full here. Okay? All the stretching in the world is not going to change 20,000 repetitions. Okay? We got to change some different postures with that. Right? So when we think about these getting very, very tight, we have a principle, it's a physical principle called reciprocal inhibition. So that when we activate a muscle on one side, it inhibits the muscle that does the exact opposite of that. So if I bend my elbow, my bicep is on, my tricep is relatively off. That's how we move. So if these are relatively on, because I'm inhaling, my exhaling. To counteract that, we want to start forcibly exhaling. That's why the baby, when it screams really loud for a while, it's really good after it. It gets itself out of that upper cross kind of high threshold posture.
That's where our headaches come in.
Exactly. We're stuck here. Because you're not supposed to yell as an adult, right? So let's all lay on our back, okay? And essentially, we are going to blow up the balloon, right? Lay on our back. Good. And so basically, the thought is we are going to be in through your nose and out through your mouth, okay? You're going to take a big breath in, and you're going to try and blow all your air into that balloon, okay? Keep going, keep going. Get all your air, literally all your air out. And when you breathe out, as you breathe out, you should feel your lower ribs kind of anchor down. Okay? As we continue to do this, what you want to do is then keep the air in that balloon. Take another really big breath in through your nose and blow a second breath of air into that balloon. You go out. Again, get all your air out and then pause for 3 seconds and get all your air out. And then you're going to do another big breath in and blow all your air out again. Depending on the size of your lungs, you may only get 2 breaths in versus 3 breaths in. You can let it all out. It's going to be good. That's cool. Yeah. So now level 2 comes in that as we breathe in and breathe out and pause, okay? I want you to not pinch the air off with your fingers on the stem of the balloon, and I don't want you to take the balloon out of your mouth. You should use your mouth to control the back flow of air in, and then breathe into your nose again. Let it all out there. It's going to be noisy, and that's going on. Breathe out. Breathe, 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 breathe. Pause. Don't hold the stem of the balloon. Don't pinch it. Breathe in through your nose, and blow a second breath.
If you want knees up, if you want to lay flat.
That is what's comfortable for you. I usually will have you bend, but for this particular technique, it doesn't matter. Now, when we get into changing how your hip is, that will become more important. But for the neck, not so much. Questions so far? You are, okay, so when you breathe into your chest, you get shallow breath in, right? Okay. We're doing a lot of very short, shallow breaths. Okay? We blow off that creates what we call respiratory alkalosis, and that causes you basically, you don't have enough to do it, but that's probably anxiety, restlessness, things like that. When we're forcing you to hold your air in and then take a big breath of air in, you're getting way more oxygen. And so, just like you can put up your oxygen before, great, right? How many, isn't there anybody who cannot blow the floor? Perfect. Can you grab a straw out of that? And so the goal is to blow out against your resistance. So if you cannot blow up a balloon, that's okay. We're going to blow up using a straw, okay? Because it's smaller airway still provides resistance. You could do it if you didn't have anything, just by pulling it out through your first lip. And the goal is this: you don't have to dedicate the whole day to it. If you take the 3 breaths into the balloon and then you let all the air out at once, you're looking to do about 5 of them. Questions so far?
Deep breaths is much.
Into there and then let all the air out. That's 1. 2, we'll do about 5 of them. The important thing here is getting all the air out. From 1. So let's try it. Let's go ahead and breathe in through your nose and blow out the air into the balloon. You blow out, you blow. Feel how that last little bit kicked in there? That's what we want. We want that last little bit to kind of kick in. That's full exhalation. That's taking this from in. We want to try and do only with our mouth. And then try not to blow out of your mouth, try not to pinch it with your fingers. And that might be a work in progress. Not everybody's good at that. But your exhalers are strong enough to do that. Okay. Any knowing that can be a work in progress. That might be something else. But, a lot of people, you'd be surprised the number of people who cannot do this. I'm actually very impressed with you guys.
We've been here.
We've done this before.
Yes.
But there's a fair few people who have a very hard time blowing the balloon. That's because they're so used to coming here and they're just used to passively letting air out. They haven't forcibly exhaled them all the time. Okay? So we're going to come back to that here in a second. But we're going to transition to balloon breathing, or not balloon breathing,